are out at UnityPoint for Wellness Wednesday, and we have got an audience of eyeballs just kind of monitoring over, and now he's not even paying attention. Oh well, that's all right. Hope everybody's having a good Wednesday. If you haven't rolled up your windows yet, make sure you do because it's supposed to rain. Trying to get a little bit of that humidity out of here and get back to normal Iowa summer weather where it's just hot and crap. Not almost ready to rain. This morning, I got a couple quick things I want to point out that are going on in the community, and I'm going to cheat to make sure I get these all right. So, the Heart and Soul Project has 3 community events coming up to hear your thoughts on what you love about Muscatine. There's been a survey out. It's out on the front page of Discover Muscatine. But those are August 13th at 2 o'clock at Musserville Church, August 15th at noon at the Riverview Center, and the 15th at 6 at Calvary Church. So what the Heart and Soul program does, and Kristen Sylvain is going to be on tomorrow to talk about this a little more, but it's helping us all as a community find what we love about the community so we can help communicate it to others as a really broad stroke, right? So make sure you can get to one of those. Don't forget Wilton Founders Day is coming up, as well as the Watermelon Stampede next Friday, Saturday for both of those, plus Sunday for the Wilton's Founders Day, of course. And then coming up a little bit later, don't forget to check out Vision Center's 50th anniversary celebration, where they're just going to have a ton of stuff. All the physicians and providers are coming back so that you can see them and celebrate the tremendous 50 years, obviously. Dr. Schultz was here yesterday, or was that Monday? I don't know, last couple of days. He was here talking about it, and it sounds like it's going to be a really good time. So mark your calendars for all those. Again, all of them, you can find more information on the discovermuscatine.com website. It's right there on the front page, or check out the community calendar. You'll find it. You'll Google it. You'll find us. But this morning I've got Dr. Williams here with me, who is going to be doing a presentation, kind of a continuation of Dr. Saga's concept, which I think works really, really well on, I guess I'll let you explain it because it's probably a little bit further out of my range of comfort to talk about than I would like to admit. So, but if you could real quick, Mark, kind of tell everybody a little bit about you because you're still fairly new. And maybe like how you ended up here, and then we'll kind of jump into what you're going to talk about in a couple of weeks.
Okay. My name is Mark Williams. I'm a general surgeon here at Trinity Muscatine for UnityPoint. Been practicing general surgery for about 17 years now out of my training. Board certified in general surgery, but also wound care management as well. I came to the area because this was a great place to raise my boys. I still live in the Princeton, Illinois area. Commute here and when I'm here on call, I stay here. But for now, I'm at least commuting until at least my son finishes high school. I've got 2 sons. One's at the Naval Academy, and
cool.
One's finishing up a senior year at high school.
Cool.
So
that sounds like a handful. Like move, commute, senior year. That sounds like a little bit of a crazy mess.
It's been
but
busy.
The good kind, right?
It is, yes, it is. I didn't want to displace my son to come over here, but the opportunity came up to work here, and so this is kind of the way got it worked out to be able to kind of do this. My wife is a nurse and a CRNA, which is a nurse anesthetist, and she travels quite a bit too. So she's been used to that. I've not been, but she has. So it's around fair play.
Yeah, exactly. Yes, very much so. So it's the 23rd, so it's a couple Wednesdays from now.
Yes.
At 5:30, out at the school district admin building, and you're going to be talking about like kind of a pain / vein function, right? Like I know
it's not so much pain; it's more of the consequences and sequelae of venous disease.
Yeah, okay. And I guess when I think of that, I guess I just assume there's pain that goes with it. I may be wrong. But yeah, just give her a little clip and we'll be good. There we go. That works.
Still hear me okay?
So what exactly, because obviously I don't understand it very well yet, So what exactly is like chronic vein disease? Like, what does it look like? What does it feel like?
Okay. Well, chronic venous disease is a condition where basically the veins stop working the way they're supposed to. Veins bring blood back to the heart
Right.
from your body. Arteries get it to the tissue, but then veins bring it back. The problem that runs into is that veins have little one-way valves, and over a period of time they can get damaged, and that venous disease gets starts to injure the tissue, and it's worse when you're standing and sitting for long periods of time, like being up on a concrete floor for most of your life, working, and it leads to injury to the tissue in your legs. It causes, you see symptoms like chronic, you see varicose veins.
Oh, right.
You
Okay.
see-
Yeah.
You see achiness, heaviness, itching, burning, swelling in your legs.
Yeah. Okay. And I guess that's where I was thinking,
Okay.
like the pain kind of, and
Sure.
I was lumping those sensations all into pain in my head. So
Yeah.
I was close, just
Yes.
like always not using the right word to describe what's going on in my head. So,
And the long-term consequences of that is that you can end up with bad damage to the tissue and the skin. You get what's called a gator distribution hyperpigmentation of the legs. You'll see people with bronzing from their knee down to their ankle, even to severe as having ulcerations. And the goal is to try and prevent this and mitigate the symptoms that people are having. 80% of people get symptomatic improvement with treatment.
that's awesome.
So the purpose of this talk is to try and educate people on what the disease process is, what types of things we can do to help mitigate it, and what surgical or minimally invasive procedures we have to offer to treat the disease.
So when I see if this is a decent analogy, so when I think about veins coming back up and like the one-way valves, it's almost kind of like I think of this is going to sound totally crazy, but like the American Ninja tower at the end where they finish and they jump up and they stop, and then they jump up a little bit more and they stop. And isn't that kind of like how those veins work, where they're kind of like little levels almost, for like, again, very simply, for where it like pushes up a little bit, the valve stops it. So then I'm assuming if the valve isn't working right, it's kind of like leaking back down, and then that creates like pressure and all that sort of stuff, right?
That's exactly how it happens,
Oh, wow.
basically. So,
Got one. Every once in a while, a blind squirrel finds a nut.
I use it as an analogy of locks. I mean, because basically,
Yeah.
the venous system is mostly what you're seeing on the outside. The cosmetic appearance of the varicose veins is due to an underlying disease process where the valves stop working.
Mm-hmm.
Those valves just basically are passive. The blood flow in that area, in that tissue, is passive. It just moves. Every time you move, your muscles squeeze. That squeezing motion pushes the blood forward in those one-way valves, and then it sits and pools. So if you stand for long periods of time, the blood's just pooling. It's not moving. But if you're moving, you're active, the muscles push that blood towards the heart. But that pooling is what causes the problem, and as long as gravity is working against you, which we all want to be upright.
Well, and I was actually just thinking, I wonder what it would be if that would still happen if we were hanging upside down. Well, or like if there was no gravity. Like, that's literally where I was just going. So,
and unfortunately, if
I don't think those are either viable options. So,
But if gravity is not working against you, you're usually lying in a bed. You don't want to be that way. So you want to be up and active. That's the most important thing. But these one-way valves, as the blood pools in those one-way valves over a period of time, of your lifetime in that position, the valves start to stretch. And when they stretch, they leak. And that pressure gets transmitted further and further down, so that the worst pressure is around your ankle. So that's where you see most of the disease. So the restless leg people, the swelling that you see, the achiness, the tiredness of your legs, those type of things are the symptoms you see from the disease process. And if you can kind of mitigate them and help remediate that, then people feel better. And that's the main reason I do this is to see people feel better from this process.
So how does somebody know, one thing I always like to help viewers at home kind of wrap their mind around is like, what might they be feeling at home, or, that says, hey, this is something that I should have on my radar. Like, some of those early, maybe like early warning signs, or like, what are some of those things that people would want to have on their radar?
Well, again, we've already mentioned quite a few of these, which basically things you start to look for. Are you having achiness when you've been on your feet for long periods of time? Do your legs feel better when you elevate them when you come home and rest? Are you seeing varicose veins, these other little things, spider veins and reticular veins? Because
And
those
that's
are
like
smaller.
where you kind of like see the blue, and like sometimes it's like a bumpy vein sort of
Yes.
a thing. Okay, that's
And those are the little smaller veins. But then the larger, ropier veins, like the varicose veins, can be severe. They can be the size of my thumb.
Oh, wow.
I mean,
Okay,
they can be that bad, and can just be little tortuous, just meandering veins down up and down your legs. The problem with those is that that means that the disease, I mean, the valves have basically stopped working altogether, and those little small veins aren't used to handling that much pressure, so they become varicose. They become enlarged and engorged.
Gotcha. So like what, I mean, and I know you're going to go over a lot of this in more detail, but like what are some of the big picture kinds of things? Obviously you mentioned movement, that sort of thing,
Right.
but like, is there anything else that's like, if you're just kind of doing this stuff, you're probably going to be in a better spot? Anything, eat, drink?
Well, it's not so much
Food?
eat and drink. Unfortunately, obesity is a big contributor to it because it impairs the return of the blood flow. So you tend to have the people who are more obese have problems. Also, I'll talk to this in more depth. There's really three venous systems, three circulatory systems. One's the arterial, one's the venous, and one's lymphatics.
Right.
And the lymphatics are kind of tied in with the veins. And that's where you end up with this chronic swelling and edema that causes the problems. But overall, I mean, you're talking about the sedentary lifestyle. If you're not moving around, if you're overweight, other risk factors are if you're over 50, if you're female, if you've had multiple pregnancies.
Ooh, I'm clear on all three of those so far. One of them will sneak up on me a little bit, but
And then other family members that have had varicose veins and chronic venous disease themselves. That makes has something to do with connective tissue process. But those are the patients that are the people who are at risk for the disease. Mitigation of the disease, basically, you want to elevate your legs at rest. You want to exercise. You want to lose weight. If you need something for pain, you take something that's not a steroid or not a narcotic. But sometimes you have to wear compression stockings, other kind of compression garments that help to reduce the swelling, because the swelling tears the skin up, and that's one of the biggest factors. Is if you have swelling in your lower legs there are multiple different reasons for it, but if you have swelling in your lower legs, that's what kind of tears the skin up and causes the problems long term.
gotcha. Okay, so that makes sense. Yeah, and as you were thinking about it, as you were mentioning like swelling and some pressure and elevating, I was thinking back to like sprained ankles and it's getting that stuff out of the limb and back up to the system where it's supposed to be.
Right.
So that sort of makes sense. I suppose.
Reducing the pressure.
Yeah. So if this like all goes untreated, like if you like say you have varicose veins and you don't address it, what does that end up like? I mean,
Unfortunately, we have patients that come in that have this woody, hardened, thickened skin on their legs that's chronically damaged. It's kind of tattooed because the blood vessels little small capillary blood vessels are broken, and that tissue is hardened. Then it tends to weep. It tends to break down. You tend to have ulceration. You have long-term pain. You have to, you end up at a wound care clinic. That's the kind of the worst of the disease process. But overall, I mean, 30 million people have the disease. 2 million of them don't really, only about 2 million seek treatment. And of that, probably about 65,000 people actually get some type of venous interventional treatment for the disease. So it's very prevalent, but it's undertreated.
Why do you think that is? I mean, like, so again, so I'm thinking, okay, you said 30 million, so that's like 1 in 10-ish.
Yes, yeah.
In the United States-ish. Okay, so I know 10 people over 50, whatever. Why would somebody, like, what might they be thinking to not go seek treatment? Because, like, if I've got purple veins, like, I'm going to the doctor because I'm like, I'm captain. I'm not like overuser, not at all that, but like, generally, if I've got a problem, I'm gonna be like, hey, call the smart people and see what they say to do, right? But like, what are some of the reasons why you see people maybe put off treatment that you could be like, hey, if you're thinking this, don't do that?
Well, I mean, varicose veins have been thought of as being cosmetic, but that in and of itself, yes, that can be cosmetic, but it's the underlying disease process that's causing them. It's not, you're not seeing
okay.
that. The thing that I've noticed is that people, the symptoms are mild compared to most things you see. You don't have any major consequences, but it is so prevalent that people just don't seek treatment for it. I mean, everybody knows that, oh, okay, I get achiness, heaviness after being on my feet for the day, and it goes away, and it's not really, it doesn't really limit your activity most of the times. That's where I think it's kind of one of those thresholds that if it's not bothering me that much, I don't want to do anything about it.
Right.
I think it becomes an issue is when you actually have people who have the ulcers, the wounds. That's where they start to looking at the treatment. At that point, the disease is pretty far advanced, and it's harder to reverse any of the consequences of it.
Yeah, and that's, what's always interesting, we talk with a lot of providers, and, like we had Dr. Schultz on, like I mentioned, and he was talking about a eye thing, and he'll laugh when I describe this, but it was like, it doesn't sound like the right thing, whatever, because it's the odd shape, football shapes, whatever. But if they get a full dilated exam by the time they're like 3, they can prevent it. But like if you don't, he was talking about a middle schoolish age kid who's like blind in one eye because you just didn't do it, right?
Right.
And so much of everything we talk about, it doesn't matter what provider it is, almost to a T, prevention and preventative action solves 90% of the problems, right? Like,
Correct.
When you first start noticing stuff, and this is why I always tell people, the first step is always the hardest. We say that a lot. It's like, oh, do I do this? Oh, no, I don't. I'll worry about it the next time, or, whatever. Getting that first step is the hardest. But it's also in some ways the easiest, because literally all you got to do is pick up the phone and call. It's like but they wouldn't call you as a surgeon, right?
Well, they can call the office. It's
Call the
certainly
office.
fine. Yeah, I mean, if they have symptoms of venous disease, I'm happy to see them in the office.
Oh,
Yeah,
oh, okay.
It's covered by
So you can do
covered
okay.
by insurance. So yes, I can see appointments for patients that have symptoms.
Gotcha.
And that's, I mean, and insurance covers this process. So like varicose veins, and like I said, typically by just treating those are considered cosmetic, but treating the underlying disease process that causes them is not cosmetic. It is medically necessary.
And I would think people could talk to their primary care provider.
Yes, certainly.
And say, hey, I had some questions about this. I was talking to, like, can you get us connected? They can help set that all up. And that's also one thing that we often like talking about is having the team concept around your healthcare, right?
Yes.
A lot of times your general practitioner does a great job of being like the captain of the team, right? And like helping make sure that, don't take this the wrong way. I know quite a few surgeons. Some of you guys get a little technical when you talk sometimes. And you don't, yeah, right. And you don't, like, you think you get it, but it's always nice to have like a translator, just like to make sure that you're not, and, follow up, obviously if you did something, you're going to be following up with them, but another set of eyes is always great, right?
Yes, definitely.
And that's where, we talk about taking control of your healthcare and taking control of your health. And that's an easy way to do it. Stay in close contact with your general, bring in the people that have, like, even if it doesn't seem like it's a big thing, have the conversation, figure out what you need to do, and just tackle it, right? So I think, what I'm trying to take away from this in my head, because I know at some point I'm going to hit 50 and start having to probably worry about this. So if you're starting to see it, right, feel some of that tingling, burning, like those kinds of things, that's when it's time to start calling, right?
Yes, definitely.
Okay.
Before it becomes too pronounced. I mean, again, a lot of this has to do with our sedentary lifestyle. I mean,
Yeah.
we tend to be overweight. We tend not to be as active as we should. The venous disease primarily is caused by the pooling of the blood that sits there. So that in and of itself is because of sedentary activity. Since it's a passive system, you've got to be active to kind of get it to work. And that's where
It's almost like every physician tells us that, we should
yeah,
pay attention to what we eat. We should
pay
be
attention,
active.
but if
And
I
yeah.
could figure it out myself, I would.
Well, and hey, you know what? I'm the same way, and this is the one thing that's always tough about this is like, and to you at home, remember this: we all face our own challenges, right? We all have whatever it is. A, nobody's perfect, and B, everybody's facing something. It doesn't matter what it is, and everybody has challenges that, like, maybe they know what to do, they just can't quite get there. Maybe they don't know what to do. It doesn't matter. We're all facing something, and we all have things that we're really good at and things that we're not so good at, and it's about finding support for the things you're not good at, right? And finding a way to get that. And it's you guys here at the hospital, the clinic, do a really great job of kind of like wrapping around people and being able to help make sure they get everything they need. So I think that's, if I could get on my soapbox, not that I don't have I should get it, Chris, we should get a prop that's a soapbox so that when I go on these little rants, I could go like stand on a soapbox somewhere. But just take that first step, you know what I mean? Take control of it and find the team to help you. Does that sound about right?
Yeah.
Close?
Yes, certainly
Wow,
does.
holy cow. That's like 2 in one day. I'm
Yes.
like on a roll. We're not going to stop this interview. We're just going to keep going all day. No, but so if you guys have questions about it, you can register on the UnityPoint website for the presentation, which is in about 2.5 weeks. Be the 23rd.
It's Wednesday.
It's Wednesday, yeah.
Yeah.
2 Wednesdays from now, the 23rd, out at the school district building. It's a nice, great facility to do that at. We did, 8, 9. We've been doing them since the start of the year with Dr. Saga. And it's definitely time well spent because you can actually stop, focus, get the information, get that base, and then follow up with the questions you have. It's a nice, compact piece of it. And of course, we'll be broadcasting it. We'll have it on PCTV. We'll have it everywhere for people to come back to. So, holy cow, that was a lot. I feel like I know way more than I did an hour ago.
Didn't talk too much about it.
Well, but
again,
just from the
yeah.
again, a lot of these things for people, it's knowing enough of that, for your healthcare, you've got to know a little bit about a lot of stuff, right?
Yes.
And, do I need to be an expert on venous disease? No, I don't. But what I need to know is, okay, yeah, burning or a little itching, pain, that's not good. Beware. So that could be this area. Make the call, right? And those are the kinds of things that I always enjoy learning because it's one more thing that you can be proactive on. So thank you very much. I appreciate it.
You're welcome. Thank
So
you for having me.
Oh, of course, anytime. And don't forget, oh my goodness, Chris, we did not get the little warm, fuzzy cuddler guys. Don't forget, if you need gifts for kids that are sick or not feeling good, come out to the window box, get the warm cuddle. I'm going to call them cuddle duddies. I know that's not what they are. But warmies, I think they are. They're like nice little stuffed animals that are filled that you can warm up in the microwave and help retain some body heat, keep warm. So stop out at the window box and get one of those if you need it. But I think that's a pretty good Wellness Wednesday. We're going to have another one in 2 weeks with you out there. So Muscatine, we will see you tomorrow. And we have another jam-packed show tomorrow. We've got 4 guests. So be ready because there's a lot coming at you tomorrow morning. Until then, enjoy your rest of your morning and afternoon, Muscatine.